number of adults with dementia is increasing rapidly, and recent discoveries have shown that good hearing is closely tied to keeping the mind sharp. Last summer, the Achieve study confirmed this remarkable connection. So, joining us right now with more information is one of the study's principal investigators, Dr. Vicky Sanchez from the University of South Florida. Dr. Sanchez, thank you so much for joining us. Welcome to iHollywood TV.
Good morning. Thank you so much for having me and the opportunity to talk about the Achieve study.
Absolutely. My pleasure. So let's go ahead and talk more about this. So, Dr. Sanchez, what did the Achieve study find? Tell our viewers more about that.
Sure. So the Achieve study was the first large-scale, long-term, randomized controlled trial to look at the effects of hearing interventions with hearing aids on brain health and other health outcomes. And what we found is that those that received the hearing intervention and were at an increased risk of cognitive decline, we were able to slow down that cognitive decline. So, in other words, treating hearing loss is potentially a way for older adults to maintain thinking and memory ability as they get older.
Now, has the Achieve study changed how doctors, currently now view and treat hearing loss?
Yeah, great question. We really do hope that the study is bringing awareness to just how important hearing is. And so we would want all healthcare providers to ask their patients how their hearing is doing, make appropriate referrals so people can get their hearing evaluated. And if a hearing loss is identified, hopefully they would encourage the use of hearing treatments such as hearing aids.
Now, Dr. Sanchez, do you think the number of cases of dementia have to do with the certain type of foods that we actually eat? Because I read online where, a study shows that a healthy diet can prevent dementia and also prevent you from aging faster.
Yeah, no, that's a great question. There are a lot of factors that go into play if someone's going to develop dementia. Science has been able to
Mhm.
identify a lot of these factors, and ultimately they include things that are not good for your health and for aging. So you would want to avoid smoking, high fat diets, things that cause cardiovascular disease, things like social connections reduce those risks. There's lots of things that are being evaluated that potentially can increase your risk of dementia. But one of the biggest factors is genetics too, which you don't have any control over. So some things are
Right.
modifiable, such as hearing loss, and other things are not modifiable, such as your genes.
Now, with this new recent discovery, what does this actually mean for the average American with hearing loss? Like, will they be acceptable to getting dementia? Because before my grandmother, got dementia, she was having hearing loss problems.
Yeah, we do not know if someone has hearing loss, that they're ultimately going to end up with dementia. That's not what the science has
Hmm.
tells us. They tell us at a population level, those with hearing loss are at increased risk of developing dementia. At an individual level, what that means is that we should try our best to be as healthy as possible to avoid such debilitating diseases like dementia. So if you do have a hearing loss, we would really encourage you to treat that hearing loss. It's going to increase your ability to communicate, enjoy your conversations, maybe be more social and physically active. All of those things are really good for your overall health, including your brain health.
And as we're talking about, hearing loss connected with cognitive decline, potentially leading to dementia, a lot of young people, they listen to music with headphones and they're blasting their music. Tell us some of the simplest ways that we can prevent hearing loss later in life, especially for the young people.
I'm so glad you brought that up. Prevention is so important. Our ears, if
Hmm.
they receive damage, it's permanent. So we really want to protect our hearing across our lifespan. Things like noise exposures for long periods of time, sometimes ototoxic medications, all those things can have a negative effect on our ears. And so we want to avoid them as much as possible. For individuals who enjoy loud music, they should be cautious that they're not listening to a long period of time because with noise induced hearing loss, there's a time intensity trade off, meaning the louder something is, the less time you should be in that environment. So, very, very loud sounds like firecrackers, you should never be in those situations without hearing protection. And sounds that are loud, such as loud music, maybe you should only be in those situations for minutes to maybe a most an hour. So we really have to be aware of what we're doing at our younger age, which might influence our hearing ability as we continue to age.
As we're talking about this topic, I did find 1 in 4 people who have a stroke can also develop dementia, as a neural damage causes cognitive loss that can reduce the social interaction and intellectual engagement. Are you aware of this, doctor? And what is your take on this specifically?
Yeah, no, thanks for asking that question. Because as I mentioned before, there's lots of things that could increase your risk of developing dementia. Having some neurological
Yeah.
insult, like like a stroke or even a concussion, can increase your risk of developing dementia and having problems with your health and brain in the future. So everything that you do in
Mm.
your life and experience in your life ultimately affects your health. So I do have had heard about other neurological conditions also increasing risk. But sometimes these are problems that we can't always modify or adjust or fix. But hearing loss is one thing that we definitely can hopefully prevent hearing loss, or if there is hearing loss, treat
Mm.
it with the appropriate technological solutions that are out there. So we can do something about it, which is really good to hear.
Now, Dr. Sanchez, where should we go for more information on all the things that we have discussed this morning?
Thanks for that. So anyone that who might be interested in learning more about the Achieve study can go to achievestudy.org. And anyone interested in learning more about hearing aids and cognition, they can go to phonic.com/cognition.
We'll have both websites appearing below. Dr. Sanchez, thank you so much for coming on the show to discuss this important topic. You take care and have a great day.
You too. Thank you.